Hi, I'm Dr. Chung. I'm going to touch upon perhaps the most important thing we as physicians can do, which is to advise and help patients achieve a healthy lifestyle through diet, exercise, and activity. In a world where we are rife with really advanced technologies, great drugs and medicines, and lots of tools, still the most important thing we can do is to live a healthy life. What you do as a patient is 1,000 times more important than what we do with all our tools. So let me just touch on that in a little more detail. When we talk about exercise, we're not obviously talking about what we saw in the Olympics recently. There is a good and a bad to exercise. Exercising and staying active is generally good for you. That's what our bodies were meant to do. Now, too much is bad for you. So where is that sweet spot? So if you look at benefit, cardiovascular benefit on this axis, and you look at exercise, when you're sedentary, you have no exercise, your benefit is pretty minimal. As you exercise, your benefit goes up to the point where you're really deriving maximal benefit. But when you go too much, I point out to the marathon runners, typically the exercise at that level leads to worse outcomes, similar in some ways to people who don't exercise at all. So you have to know what the right thing is for you. Where is that sweet spot where you're getting the greatest benefit? Well, it depends on who you are, what your genetics are like, how old you are, whether you have knee pain. Generally speaking, about 3 to 4 times a week, 30 to 45 minutes of aerobic exercise, meaning not just lollygagging and stopping after 5 minutes, but brisk walking to the point where you can carry on a conversation, but you're sweating a little bit and you might be a little bit short of breath. That's the sweet spot for exercise in many patients. Now, let's say you have terrible arthritis and you can't do that. There may be other forms of exercise that include being stationary. Sometimes water aerobics or swimming pools allow you to be lighter so you can do more. But for the vast population that are mobile, this would be considered the ideal exercise prescription. Now, when we talk about diet, there's just a million diets out there. I'm not really talking about how to lose weight, although that's very important. My sense is that as a country, our dietary recommendations and understanding are changing and evolving from too many fats are bad for you, got to lower the cholesterol, I think, and focus on grains and whole grains. I think that over the years has been misplaced, and at this point I would say the science is directing us a little bit away from carbohydrates, so grains and things like that, to more vegetables and proteins. And you'll hear this all over the place. If we can cut out the carbohydrates, generally that has a good effect on your weight as well as your blood testing for cholesterol and things like that. So in general, the Mediterranean diet would be considered something we recommend. For those of us who've been lucky enough to go to the Mediterranean, some of you may know, the diet is consisting largely of fresh foods, not foods that you go out and buy in a package, but typically vegetables, a lot of seafood, olive oil, these kinds of foods that are common in the Mediterranean countries. So the Mediterranean diet is something that I think we should all aspire to. It's easy enough to find guidelines that help you do that. Now, the American Heart Association and various different organizations have their recommendations as well. But putting all that together, if you had to say the most important focus, it should be on fresh foods, mostly vegetables, and just don't eat too much. I think portion control is a major issue. So I think typically if we can get away from the full platter, cut it in half, mostly vegetables, and and proteins, and stay away from carbohydrates. That would be a reasonable start. Thank you.